1. In emergency instruction scenarios, what is the most effective adult learning strategy to ensure knowledge retention? A. Rote memorization of protocols. B. Instructor-led lectures only. C. Simulation-based training. D. Reading policy manuals aloud. 2. Which evaluation method best determines a clinical instructor's effectiveness during safety drills? A. Number of students trained. B. Verbal feedback from staff. C. Direct observation and performance checklists. D. Self-assessment forms only. 3. When developing curriculum for emergency procedures, what principle ensures alignment with adult learning? A. Emphasis on passive content delivery. B. Prioritizing learner autonomy and experience. C. Reducing all content to essential vocabulary. D. Repetition without variation. 4. In compliance with F-02 regulations, the safest instructional method for fire extinguisher use is A. Viewing a video demonstration only. B. Practicing with actual equipment under supervision. C. Reading from the manufacturer's manual. D. Discussing theory in a classroom. 5. What is the primary reason for debriefing after a safety drill in adult education? A. To fulfill a regulatory mandate. B. To promote reflective learning and improvement. C. To assess attendance. D. To evaluate the instructor's performance only. 6. Which mentoring strategy is most suitable when onboarding new emergency safety instructors? A. Micromanagement and strict oversight. B. Directive feedback without discussion. C. Collaborative coaching and peer observation. D. Assigning independent study with no interaction. 7. A clinical instructor adapting emergency curriculum for shift workers should prioritize A. Extended classroom hours. B. Self-directed e-learning modules. C. Single-session intensive workshops. D. On-call live demonstrations only. 8. Which of the following best ensures regulatory compliance in emergency training documentation? A. Student names and test scores. B. Training content, dates, and instructor credentials. C. Classroom attendance logs only. D. Instructor's daily work schedule. 9. Which type of communication is most effective for ensuring adult learners understand evacuation protocols? A. Text-only handouts. B. One-time announcements. C. Interactive discussions and visual aids. D. Policy memos via email. 10. What is the most efficient method to assess knowledge retention in adult learners post-training? A. Timed multiple choice tests. B. Informal verbal questioning. C. Scenario-based assessments. D. Learner satisfaction surveys. 11. Which is an essential feature of effective emergency response curriculum? A. Passive reading assignments. B. Realistic scenario-based practice. C. Daily written reflections. D. Lectures without assessment. 12. The best way to mentor a struggling emergency safety trainee is to A. Reassign them to another department. B. Provide constructive feedback and coaching. C. Ignore performance issues. D. Repeat the training material verbatim. 13. Which of the following best illustrates compliance with adult learning principles? A. allowing learners to set personal goals. B. Repeating content to ensure memorization. C. Using a single instructional style for all. D. Limiting learner interaction. 14. During clinical safety instruction, which method increases learner engagement? A. Instructor monologue. B. Open-ended questions and guided discussion. C. Repetition of safety protocols. D. Memorization of emergency codes. 15. How should a curriculum be adjusted to accommodate diverse adult learners? A. Use a universal lecture format. B. Provide visual, auditory, and kinesthetic options. C. Offer training only during standard hours. D. Keep assessments uniform. 16. The purpose of formative evaluation in emergency training is to A. Certify participants. B. Provide real-time feedback for improvement. C. Rank learner performance. D. Report statistics to supervisors. 17. When developing an emergency response course, which factor is most critical to address? A. Learner motivation and prior experience. B. Instructor convenience. C. Budget limitations. D. Location of training room. 18. Which method is best for assessing psychomotor skills in emergency scenarios? A. Multiple choice exam. B. Peer feedback. C. Practical demonstration. D. Online survey. 19. What is a key benefit of using peer mentoring in emergency preparedness training? A. Reduces training time. B. Encourages uniformity without questioning. C. Reinforces learning through collaboration. D. Limits the need for formal evaluation. 20. In regulatory compliance training, how should updates to safety standards be communicated? A. Periodic memo distributions. B. Integration into ongoing instruction and discussion. C. Posting on a break room wall. D. Including in end-of-year review only. 21. The best instructional approach to teach adult learners about hazardous material response is A. Reading the OSHA manual. B. Interactive simulations with real-time feedback. C. Watching pre-recorded videos. D. Listening to a lecture. 22. What principle should guide an emergency safety instructor's feedback? A. Delayed and summative. B. Vague to avoid discouragement. C. Timely, specific, and constructive. D. Generalized praise. 23. An effective emergency curriculum includes A. Frequent ungraded quizzes. B. Standard PowerPoint slides. C. Real-world case studies. D. Long theoretical essays. 24. Which strategy helps ensure equitable learning outcomes in safety compliance education? A. Universal lesson delivery. B. Culturally responsive materials and language. C. Instructor-focused lecture methods. D. No learner accommodations. 25. The most appropriate evaluation tool for determining procedural accuracy during drills is A. Written reflection. B. Observation checklist. C. Peer interview. D. Group quiz. 26. How should instructors address resistance from adult learners during emergency training? A. Ignore it. B. Punish non-participation. C. Explore underlying concerns through discussion. D. Force attendance. 27. What is the main goal of summative evaluation in emergency preparedness instruction? A. Diagnose individual needs. B. Provide ongoing feedback. C. Determine overall program effectiveness. D. Motivate peer engagement. 28. To maintain compliance with F-02 guidelines, instructors must A. Conduct safety drills annually. B. Update and document training plans regularly. C. Focus only on theory. D. Leave records unfiled. 29. A common barrier to adult learning in clinical settings is A. Too much visual support. B. Lack of life experience. C. Limited time and competing priorities. D. Over-reliance on personal judgment. 30. When mentoring new staff on emergency protocols, experienced professionals should A. Supervise without engagement. B. Offer real-time coaching and feedback. C. Focus on theory only. D. Withhold key information for later. 31. What is the most important aspect of evaluating clinical instruction effectiveness? A. Instructor popularity. B. Student enjoyment. C. Learner performance outcomes. D. Number of sessions conducted. 32. When customizing emergency response training for night shift workers, instructors should A. Use identical schedules to day shifts. B. Offer self-paced digital training. C. Skip hands-on drills. D. Shorten the curriculum. 33. Which of the following aligns with adult learning theory in clinical emergency instruction? A. Imposed content. B. Passive lecture style. C. Problem-centered learning activities. D. Fixed memorization modules. 34. The key to successful emergency instruction communication is A. Clarity and relevance to the learner's role. B. Legal jargon to ensure formality. C. Frequent email updates. D. High-level vocabulary. 35. To evaluate an instructor's competency in emergency procedures, supervisors should A. Review training budgets. B. Conduct peer evaluations and observe training sessions. C. Ask learners only. D. Skip direct assessments. 36. Which mentoring behavior contributes most to developing emergency response skills in others? A. Demonstrating tasks while explaining the rationale. B. Giving orders without explanation. C. Avoiding questions. D. Monitoring from a distance. 37. The most effective curriculum for safety compliance includes A. Legal theory and citations only. B. Job-specific procedures and application. C. Organizational charts. D. Historical case studies. 38. What ensures long-term knowledge retention in adult learners after emergency training? A. One-time instruction. B. Intermittent review and practice opportunities. C. Memorization of acronyms. D. Paper-based evaluations. 39. Instructors should use which tool to measure readiness for real-world emergency application? A. Role-play scenarios. B. Weekly written summaries. C. Online policy tests. D. Verbal quizzes. 40. What communication practice is critical during clinical safety training? A. Speaking in medical terminology only. B. Two-way dialogue and learner questions. C. Instructor lecture without breaks. D. One-time instruction. 41. How can adult learners be motivated to engage in emergency compliance training? A. Incentives alone. B. Making content relevant to their responsibilities. C. Assigning additional tasks. D. Limiting group activities. 42. What is a benefit of including learner feedback in program development? A. Delays curriculum updates. B. Ensures buy-in and relevance. C. Shifts focus from goals. D. Adds confusion. 43. The best way to assess behavioral change after emergency instruction is A. Surveying instructor opinions. B. Reviewing training materials. C. Observing performance in drills. D. Reviewing sign-in sheets. 44. Which of the following is the most effective method to address errors in emergency performance? A. Public reprimand. B. Delayed retraining. C. Private debriefing with constructive suggestions. D. Ignoring errors. 45. What principle of adult learning encourages the inclusion of real-life examples in training? A. Andragogy. B. Behaviorism. C. Constructivism. D. Classical conditioning. 46. When evaluating emergency procedures curriculum, instructors should prioritize A. Learner entertainment. B. Compliance with institutional protocols. C. Flashy visuals. D. Peer reviews. 47. Mentorship in emergency training is most effective when it A. Follows a top-down command structure. B. Builds mutual trust and open communication. C. Avoids relationship building. D. Limits feedback. 48. A clinical instructor demonstrates regulatory compliance by A. Updating personal certifications only. B. Reviewing staff credentials annually. C. Recording training outcomes and attendance. D. Sending email updates to HR. 49. The foundation of a quality clinical emergency training program is A. Routine repetition. B. Continuous assessment and improvement. C. Avoidance of change. D. Focus on quantity. 50. To support adult learners during stress-inducing drills, instructors should A. Skip explanations. B. Provide emotional support and reassurance. C. Use fear as motivation. D. Shorten practice time. 51. What instructional design principle is best applied to emergency procedures training for adults? A. Linear progression with no flexibility. B. Immediate application of content to practice. C. Memorization drills. D. Standardized testing focus. 52. How can an instructor measure learner confidence in emergency response tasks? A. Post-course written exam only. B. Peer feedback during group work. C. Self-assessment and performance observation. D. Training completion certificates. 53. Which feature is essential in a safety compliance training program for adult learners? A. Independent textbook review. B. Repetitive exams. C. Real-world applicability. D. Single modality learning. 54. A critical component of mentorship for new emergency trainers includes A. Avoiding performance evaluations. B. Giving access to training manuals only. C. Observational shadowing and feedback. D. Assigning solo duties immediately. 55. What technique supports effective communication when instructing during an emergency simulation? A. Delivering monologues. B. Providing continuous verbal cues and clarity. C. Using handouts only. D. Delaying directions until the end. 56. What strategy aligns with adult learning when updating long-serving staff on new safety protocols? A. Retraining from scratch. B. Relating changes to existing experiences. C. Presenting information with no context. D. Emphasizing theoretical relevance only. 57. What is the best way to ensure new employees are compliant with F-02 emergency procedures? A. Have them sign an acknowledgement form. B. Include them in hands-on simulations and evaluations. C. Send a policy document by email. D. Offer optional attendance. 58. To measure the effectiveness of emergency safety instruction, instructors should A. Review evaluation forms only. B. Track knowledge transfer and behavioral change. C. Count attendees. D. Monitor satisfaction levels. 59. When should instructors revise the emergency procedures curriculum? A. Once every 5 years. B. After any policy update or training evaluation. C. Based on instructor preference. D. Only when mandated externally. 60. The best way to assess understanding of fire safety zones is A. A matching vocabulary quiz. B. Simulation of evacuation scenarios. C. Instructor demonstration only. D. Verbal Can-Day. 61. In adult education, how does mentoring differ from traditional instruction? A. Focuses on rote learning. B. Emphasizes personal development and feedback. C. Prioritizes content delivery only. D. Avoids interpersonal relationships. 62. What instructional technique ensures inclusive learning and safety compliance? A. Cultural neutrality. B. One-size-fits-all instruction. C. Multilingual materials and examples. D. Limited learner participation. 63. What motivates adults to engage in mandatory emergency training? A. Extrinsic pressure. B. Fear of consequences. C. Perceived relevance and autonomy. D. Frequent testing. 64. Which of the following best defines backward curriculum design in emergency training? A. Start with learning activities and design goals later. B. Begin with assessment goals and build from there. C. Prioritize instructor needs. D. Focus only on available resources. 65. Which type of feedback is most effective in reinforcing emergency safety behaviors? A. Monthly reports. B. Immediate, clear, and specific feedback. C. Instructor notes reviewed annually. D. Public performance comparisons. 66. How can instructors increase engagement during mandatory safety training? A. Shorten the session. B. Incorporate interactive tasks and decision-making. C. offer only slides. D. Reduce discussion. 67. Which assessment type is best for evaluating decision-making during a mock fire drill? A. Written exam. B. Checklist observation and scenario scoring. C. Group discussion afterward. D. Instructor-led quiz. 68. To ensure ethical mentorship in emergency instruction, mentors should A. Focus on professional growth and confidentiality. B. Provide rewards for compliance. C. Enforce rigid discipline. D. Delegate all teaching. 69. What factor most influences adult learners' ability to apply emergency protocols? A. Amount of content. B. Personal experience and situational practice. C. Lecture length. D. Instructor charisma. 70. What approach should an instructor take when a learner struggles with alarm activation procedures? A. Repeat lecture. B. Assign written reading. C. Provide one-on-one coaching with modeling. D. Require retesting without assistance. 71. How can communication barriers be reduced during emergency training? A. Provide uniform printed materials. B. Encourage open dialogue and clarify misunderstandings. C. Deliver content rapidly. D. Limit learner questions. 72. In clinical training, which of the following promotes skill mastery in emergency response? A. Frequent verbal lectures. B. Realistic simulations with instructor feedback. C. Theoretical exercises only. D. Group debates. 73. The purpose of reflective journaling in safety training is to A. Summarize readings. B. Track attendance. C. Enhance personal insight and learning transfer. D. Evaluate the trainer. 74. When mentoring clinical instructors, what is a best practice? A. Assigning them independent study. B. Including them in co-facilitated sessions with feedback. C. Avoiding peer interaction. D. Limiting them to observation. 75. An effective curriculum plan for emergency training includes A. Vague learning goals. B. Predefined objectives, assessments, and activities. C. Focus on instructor preference. D. Random scheduling. 76. What is a key component of formative evaluation during hands-on emergency training? A. Measuring annual compliance rates. B. Providing learners with real-time corrective input. C. Issuing certification. D. Reviewing final grades. 77. How can instructors ensure learners understand chemical safety symbols? A. Use flashcards only. B. Provide chart and explain through examples. C. Refer learners to OSHA. D. Avoid in-depth explanation. 78. Adult learning retention is improved by A. Passive listening. B. Written reports. C. Active practice and spaced repetition. D. Single session delivery. 79. The most appropriate communication style during high-stakes emergency drills is A. Formal and scripted. B. Passive and quiet. C. Assertive, clear, and supportive. D. Technical and complex. 80. Which method best helps adult learners internalize CPR procedures? A. Watching a demonstration only. B. Hands-on repetition with immediate feedback. C. Reviewing protocol sheets. D. Attending a single lecture. 81. How can instructors align safety training with F-02 regulations effectively? A. Refer to outdated standards. B. Customize drills based on local code updates. C. Skip documentation. D. Use a national template only. 82. What is a drawback of using only lecture-based training for emergency procedures? A. High instructor workload. B. Lack of hands-on skill application. C. Excess learner autonomy. D. Too much feedback. 83. The primary goal of using case-based learning in emergency training is to A. Confuse learners with details. B. Promote critical thinking and real-world application. C. Limit discussion. D. Reinforce memorization. 84. Which tool should be used to track learner progression in safety compliance training? A. Attendance sheet. B. Grading rubric and checklist. C. Verbal approval. D. Email summaries. 85. What quality is most critical in a clinical instructor teaching emergency protocols? A. Charisma. B. Adherence to regulations and ability to adapt. C. Speed of delivery. D. Title and rank. 86. A regulatory compliance breach in emergency training is best addressed by A. Ignoring it. B. Issuing blanket retraining. C. Root cause analysis and corrective action. D. Penalizing learners. 87. How should an instructor structure feedback in high-risk scenario training? A. Wait until end of session. B. Offer vague praise. C. Provide timely, specific, and goal-oriented input. D. Avoid interrupting performance. 88. What role does cultural competence play in emergency instruction? A. Avoidance of sensitive topics. B. Enhancing inclusion and engagement. C. Increasing uniformity. D. Making training longer. 89. To develop leadership in emergency preparedness, instructors should A. Focus on task completion only. B. Encourage initiative and decision-making in learners. C. Discourage independent thinking. D. Assign tasks without context. 90. When designing curriculum for diverse adult learners, instructors should A. Use identical materials for all. B. Incorporate learner experiences and backgrounds. C. Avoid flexibility. D. Focus on memorization. 91. What is the most important factor in the success of a peer mentoring program? A. Mandatory participation. B. Clear goals, structure, and support. C. Unstructured meetings. D. Rigid hierarchy. 92. Which of the following best demonstrates adult learning in a clinical safety setting? A. Reviewing protocols with no context. B. Practice-based learning with immediate relevance. C. Weekly mandatory lectures. D. Memorization challenges. 93. Which instructional tool provides the highest realism in emergency response learning? A. Slideshows. B. Group discussion. C. Simulation with scenario variation. D. Informational posters. 94. How can instructors gauge the effectiveness of communication during safety training? A. Observe learner behavior and ask clarifying questions. B. Count questions asked. C. Review materials after class. D. Check test scores only. 95. What factor most contributes to emergency drill success? A. Time of day. B. Learner preparedness and clear roles. C. Weather conditions. D. Instructor's speaking speed. 96. Effective evaluation of learning in emergency response includes A. 1. Final exam. B. Observation, assessment, and learner feedback. C. Attendance confirmation. D. Multiple choice test only. 97. Which mentoring method helps solidify emergency response skills? A. Monthly check-ins only. B. Shadowing and co-facilitation with debriefing. C. Text-based resource sharing. D. Informal coaching only. 98. Adult learners benefit most from emergency safety training that A. Provides theoretical analysis. B. Reflects real-life roles and responsibilities. C. Is led by senior management. D. Uses outdated procedures. 99. Which strategy best supports a trauma-informed approach to emergency instruction? A. Avoid emotional discussion. B. Provide choice, safety, and empowerment. C. Require repeated drills without discussion. D. Keep learners uninformed of drill content. 100. What is the most important element when evaluating emergency safety instructors? A. Appearance and presence. B. Clarity, engagement, and learner outcomes. C. Strict rule enforcement. D. Speed of content delivery. 101. What is the most effective method for evaluating the transfer of emergency response knowledge to the workplace? A. Pre- and post-training quizzes. B. Peer interviews. C. On-the-job performance assessments. D. Completion certificates. 102. In mentoring new instructors in safety training, which strategy promotes reflective practice? A. Standardized testing. B. Guided journaling and post-session debriefs. C. Repetition of course content. D. Solo instruction assignments. 103. Which communication barrier is most likely to hinder emergency training effectiveness? A. Excessive multimedia use. B. Technical jargon without clarification. C. Humor during drills. D. Strict time management. 104. The best way to address different learning styles in emergency procedures training is to A. Use only written protocols. B. Rotate instructors frequently. C. Incorporate visual, auditory, and kinesthetic methods. D. Keep the format consistent. 105. Which is a key adult learning principle that supports behavior change during safety training? A. Competition. B. Respect for learner autonomy. C. Use of disciplinary measures. D. Long lectures. F-02 Emergency Procedures and Safety Compliance. The F-02 Emergency Procedures and Safety Compliance Test is a certification exam designed to assess an individual's knowledge and competency in responding to fire and emergency situations within a building or workplace setting. The exam evaluates understanding of fire prevention, emergency evacuation protocols, alarm system operation, and the roles and responsibilities of fire guards. It also covers safety compliance with local fire codes and regulations as set by the Fire Department of New York (FDNY). Candidates are tested on effective communication, use of fire extinguishers, reporting procedures, and safety planning. The F-02 certification is typically required for individuals responsible for overseeing fire safety in shelters, residential facilities, and other designated occupancies lacking a full-time fire safety director. Here are the top 5 beneficial uses of the sample exam. 1. Fire safety readiness. The F-02 test ensures that individuals are trained to manage fire emergencies, improving preparedness and minimizing risks in shelters and residential facilities. 2. Regulatory compliance. It helps organizations meet FDNY legal requirements for fire safety staffing in designated occupancies, avoiding fines and shutdowns. 3. Emergency response leadership. Certified personnel can lead evacuations, operate fire alarms, and guide others safely during emergencies, enhancing overall safety infrastructure. 4. Career advancement. Holding an F-02 certificate can open opportunities for employment in public safety roles and facility management. 5. Public protection. Certified individuals contribute to the safety of vulnerable populations, such as residents in homeless shelters, by ensuring prompt, informed emergency actions.